Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Science and Public Policy at Walden University, and it is with great honor that I presented this at the World Congress of Neurology, the 26th World Congress of Neurology that took place in Montreal, Canada. What this talk is all about is the association between rheumatoid arthritis and stroke-related mortality. Now, some of the other types of relationships may be self-evident. However, when we're talking about rheumatoid arthritis, this is the most common type of autoimmune disorder, and this is something that has long-term consequences in many of the organs within the body. So it comes at no surprise that rheumatoid arthritis is kind of the underlying mechanism for stroke. However, again, in this research question, the idea was how severe was the stroke, and this was severe enough that it caused mortality. So rheumatoid arthritis, an autoimmune disorder, can actually cause stroke-related mortality. And I can say this because this is a longitudinal sort of effect, and this was actually done through Cox regression, complex samples Cox regression, in order to determine this. And so the follow-up was through December 31, 2019. And the years that were studied were between 1999 and 2010 for rheumatoid arthritis and stroke-related mortality. So let me zoom in on this diagram. Sometimes this takes a little bit of trying to make sure that zooming in works. And so as you can see, the hazard ratio, and this hazard ratio is not overall mortality, this is stroke-related mortality. Well, rheumatoid arthritis is indeed causing higher levels of stroke-related mortality. In fact, 2.73 times. Now, what is interesting to note is that when there is adjustment for potential confounding factors, for instance, diabetes, obesity, age, gender, some of the ones that are quite common, even then, there in fact is a two times likelihood of stroke-related mortality than the general population. Again, this is showing the relationship between strokes and arrhythmias, heart failure, myocardial injury, and another syndrome. So this connection is quite clear. And then I want to tie this back to social determinants of health. And let me zoom back out here and then zoom back into this diagram right here. And as you can see, disparities research is very much needed because with social determinants of health, there's proximate individual factors, for instance, sociobiological, sociocultural, psychosocial. All of these can be combined with rheumatoid arthritis and how individuals culturally may be treated by this. And then here are the intermediate structures that are there, and that's the provider healthcare system, physical and built environment, and then of course there's individual behaviors and risk factors that we talk about a lot. And here are kind of some of the socioeconomic inequalities and ethnicity as well. So places of employment, discrimination, not having a quality education, or political representation are also kind of factors that lead to social determinants of health, combining with some of the effects of rheumatoid arthritis on stroke-related mortality. So going back to this, I hope this has made some sense. There's a lot of components that are going on with the sociobiological. So social part is the social determinants of health, and then biological part is the connection between stroke and rheumatoid arthritis and stroke-related mortality. And of course, rheumatoid arthritis very strongly affects the heart as well. So this is the connection, and these are the underlying mechanisms. I hope this has made some sense. Thank you for listening.